We have, and I think the recommendation was almost the same with what the auditors are saying.
So you have a report that you have adopted as a house?
Yes.
So you have adopted as a house?
Yes, we did.
So you can table the report before the committee. Thank you, Senator Mbogwa, for reminding me that. Senator Kisang?
Chair, I have also looked at the one for Ugunja, and the response is basically the same. They already have created 4 ads, and they are saying they are doing it progressively. So maybe what the governor needs to tell us is this progressive, you know, so it can also be long. So we need the timelines. Now that you already have the 4th ad, when are you planning then to allow them to collect revenue, to collect to charge rates, advertisements, waste management systems? So what is stopping you then, now that you already have the 4th ads and the others, so you release the baby?
Senator Siaya?
Chair, mine is similar to what Kisang is saying. I'm just wondering if the governor can tell us the biggest challenge that he's facing in transferring the functions, because it is to his advantage, Chair, when he has 3 municipalities operationalized and given their semi-autonomy, it will be to your advantage. What is the biggest challenge that you cannot release them now?
I agree with you on that question. In fact, at a personal level, I've always been trying to push this agenda forward. It gives us less headache if the municipalities run as independent or semi-autonomous entities. But as I've said, at the county level, we need also enabling legislation, and there is a bill which has been passed by our executive committee and is on its way to the county assembly to enable us properly to be able to municipalities operate accounts outside the county, the CRF account, and I think once that is done, it will be a lot smoother, as has been happening before. These payments are done from the county CRF account, and the process of opening individual accounts for these municipalities need to have a legal basis. Otherwise, the managers would find it difficult to operate those accounts without enabling legislation.
Senator Kisang had asked about the timelines.
I think within the next 6 months, this exercise should be complete.
Chair, I thought you are guiding the governor that as a county they will agree on the sharing formula of the resources or the revenue from the municipality.
I think he has said that there is a bill they have sent to the county assembly. Maybe, Governor, you can tell us whether that bill talks about revenue functions, like revenue sharing between the municipality and the county executive.
Yeah, that is very important. We do have in our previous and current budget separate budgetary allocations to the sub-counties, but we need to have a formula which is the basis of this intended legislation or bill, a basis of having a more predictable basis of sharing revenue with our municipalities, because if it is just left as a matter of discretion on the county government, then they may not be able to have their fair share. The other thing is also for them to have their power and authority outside the the county revenue system to collect revenue that is rightly in the domain of the municipalities. So I hope within 6 months this exercise will be complete.
Senator Kisam?
Chair, the governor said 6 months. Maybe it is good for him to lower the timelines so that he can begin from the next financial year, so that this thing does not become an audit query. So instead of 6 months, he can promise by July, as he begins the new financial year, you can let them go.
I take that advice, and on my part, actually, I've been pushing my people that, we really need to make these entities autonomous, and we cannot be controlling them.
Maybe just a confirmation, Governor, you can tell the committee, do you have boards for these municipalities? Are they in place?
So we have boards for the municipalities.
I would like a comment from Dr. Ndungo from Treasury. We had tasked you to follow up on the issue of vote heads in IFMIS, because many counties that appear before us have said that in the current IFMIS setup, it is difficult to create vote heads for municipalities. And therefore, that is the reason why county executive would have difficulties in processing payments related to municipalities. So what have you done as Treasury? We had asked you to follow up on that.
Thank you, Chair. I think with the process of having separate codes, normally we do the mapping of the county so that they are given the separate vote heads. Just like the Siaya county, they are saying they have separate vote heads, such that now when any payment is made, it is reflected in the name of that county. I think that is a work in progress. We have, for those counties which have requested their separate codes, I think the IFMIS had mapped the entities for the separate accounts codes. Thank you, Chair.
Senator Tobiko, put yourself on record.
Thank you, Chair. Mimi ndio Tobiko kutoka Kajiado County and a member of this committee. Thank you.
Thank you for the excellent reception in Kitengela. That is on a light note. We are on the issue of independence of the municipalities. So, honorable members, any more query or comment on this matter? Maybe if I can just get a clarification from the county assembly on this matter. Just a comment. You are not here to ask questions because you are not part of the committee, but you can comment on something.
Thank you, Chair. I think when I said that the recommendation from the Auditor's Office is also what we have said on the same. The municipality should be given more powers to run on their own finances, so that when they give a report, it will be a report touching on them alone, instead of being referred to the treasury of the county executive.
So I see in your report you have talked about 3 months.
Yes.
From the data adoption of this report. Yes. And the governor said there is a bill coming to you. When that bill comes to you, have you put in place mechanism to fast track that bill?
We one thing that anything that will make improvement on Siaya, we won't hesitate. We'll check on it. We'll also get some advice from the experts. We'll act on it.
Okay, so honorable members, the reason why we said this is the main query is because all the other queries are directly related to this one, and therefore I think Governor, we will wait to see the immediate actions you are going to do, particularly the bill issue, and then we hope that this matter will be resolved. So honorable members, I think we get to the end of municipalities. The other queries and the responses will adapt the written submission. Where we need further clarification, we will do so in writing to the county. So that means we are done with the municipalities, and we now proceed to water. Sibbo Water and Sanitation Company. Very well. I think we have some new officers who have joined us, including our former colleague, Professor Odol. Karibuni sana. So Governor, you can help us to introduce the staff who have joined us.
Thank you, Chairman. I will ask the professor to introduce herself and then proceed to the other members who have just come in.
Thank you, Chair. Thank you, Governor. Professor Jacqueline Odwell, the County Executive Committee member, Water, Irrigation, Climate Change, and Natural Resources, Siaya County.
Thank you, Chair. I'm Adipo Isaiah Wasonga, Managing Director for Sibbo, Siaya Bondo Water and Sanitation Company Limited. Thank you.
Kevin Okundi, Finance Team
Just
Sibbo.
stand up so that we can see your face.
Kevin Okundi, Finance Manager Sibbo.
Good morning. Ujambo Leonard, Manager Audit Sibbo.
Ambassador Frost Josiah, Director Sibbo.
Okay. We have a member who has joined us. Please put yourself on record.
Thank you, Chair, members, governing your team. My name is Senator Chimera. I come from Kwale County, member of this committee.
Very well. So, Auditor, you can take us through the report, a brief, and then again, I'll give directions on how we'll proceed.
Thank you, Chair. This is a report of the Auditor General on Sibbo Water and Sanitation Company, Limited for the year ended 30th June 2025. The report on financial statement is a qualified opinion. And out of the 10 issues that were raised, 1 have been addressed, 7 not addressed, and 2 partially addressed. But overall comment is the major issue which is emanating from there is material uncertainty of going concern, the issue of non-revenue water, which is at 48%, and the issue on customer deposits which have unreconciled balances.
Very well. So I think what we will look at the issue of excess non-revenue water and the issue of long outstanding receivables. Honorable members, the two issues from our experience, it's also related to the first issue of material uncertainty. So as we debate, you can try and reflect on that as well. So Auditor will start with the long outstanding receivable, but before we start, County Assembly, do you have any report? You can table it. So Auditor, start with the long outstanding receivables.
Thank you, Chair. Long outstanding receivables. The statement of financial position, and as disclosed in Note 20 to the financial statements, reflects a balance of Kenya shillings 117,311,125 in respect of trade receivables. Review of the aging analysis schedule reflects an amount of Kenya shillings 105,674,893, or 90% of the customer's debts, which remained uncorrected for a period of over 120 days. Management did not provide evidence on follow-up on the outstanding debtors, casting doubt on the ability of the company to recover all outstanding debts. Further, the movements in headquarter suspense account opening balance from Kenya shillings 2,213,213 to closing balance of Kenya shillings 3,289,475 has not been supported. In the circumstances, the coverability of Kenya shillings 105,674,893 and accuracy of headquarters suspense account balance of Kenya shillings 3,289,475 could not be confirmed.
Very well. Governor, your management response?
Yeah, the management response is as follows. The management is currently implementing the strategies which is spelled out in this response, which is aimed at enhancing the recovery of the outstanding debts owed to the company. These strategies have had positive effect or impact, with the outstanding debts reducing from 117 million odd as at 30th June 2025 to stand at 109 odd million as at 31st December 2025. And then there is a table which is in this response showing the areas where the company operates and particularizing the debts that are outstanding in those particular areas. At page 3A, Roman 1, that is pages 88 to 89, we have a debtors report for Siaya, Bondo, Yala, and Ugenya areas as at 31st December 2025. That is up to the close of the second quarter of the financial year 2025-2026. Engagement of an external debt collector to go after our long outstanding debtors, while also offering training and advice to the company's own internal debt recovery unit. This is being spelled out as one of the strategies we're using. A total debt of 1.1 million odd shillings has so far been collected by the external debt collector, focusing entirely on recovery from dormant, cut-off, and sealed accounts. That is where customers no longer are in the service area of the company. Then an extra 3.1 Roman 2 at pages 90 to 111 is a sample of the collection by the external debt collector and the report thereof. Number 2, we have had issuance of demand letters and notices to customers with long outstanding debts. That is contained in Annexure B at pages 112 to 115 for purposes of this report. Number 3, entering into part payment agreements with customers to ensure continued supply as a customer service their accrued water bills. Annexure 3C, pages 116 to 117, the sample payment agreements with customers. Annexure 3C, Roman 1, at pages 118 to 123, is a sample of customer statements to evidence honoring of the part payment agreements with the customers. Number 4 is the issue of adoption of smart meters, there is Annexure 3D at pages 124 to 125, and this is aimed at 1, improving meter reading accuracy, 2, reducing cases of billing disputes, 3, improvement of customer willingness to pay for water bills, 4, reduction of costs associated with manual meter reading, such as motorbike running costs, 5, timely meter reading and sending out of customers' bills, and number 6 is 100% collection of billed revenue. There's the engagement of National Water Police to curb non-revenue water and strengthen revenue collection in all schemes. During the year, Kenya shillings 3 million odd have been collected by this team. That is found in annexures 3E at pages 126 to 131. 6, disconnection of customers with outstanding bills. The company, on a continuous monthly exercise, undertakes disconnection exercise of customers with their arrears, and then the same is reconnected or payments or payment or part payment is made. At annexure 3F at pages 132 to 133 is a sample monthly disconnection report. On the headquarters suspense account support schedule, the management has since availed the account statement for the auditor's review, and that is at the appendix, which is found at pages 222 to 253. That is the response. And if there are any further questions, I'll defer to the CEO to answer.
Very well. Auditor, what is your comments on the response?
There was improvement in correction by 7% from 117 million to 105 million. So I think there is a positive improvement in correction of receivables, and having reviewed the response in terms of the strategies the management have put in place, I think if they do go in that direction, the balance will continue reducing. Thank you, Chair.
Maybe the CEO through the governor, you can tell the committee how much of these receivables are for institutional entities.
Thank you, Chair. On the receivables, around 40% of them originates from government institutions. Chair, the disbursements in most institutions come probably on a quarterly basis, and one of the leading customer owing us a lot of money is the Minister of Interior, that is the Kenya Police Unit, both AP and the other wing. So you realize that probably their payment comes probably once in a year, and of course schools is also affected. Otherwise, we are trying our level best, because some of them are very unique in their nature, having probably closing their water in cells and the rest. So we continually engage even the HQ so that the disbursement are made. Thank you, Chair.
So have you sent demand letters to these institutions?
Chair, we have done, and normally when we send demand letters, we will copy to their heads at the county levels.
Okay. We last Friday, honorable members, we made a decision that this committee is going to take up that matter, especially for national government owing these water entities a lot of money, because 40%, if you apply it to the current receivable balance, it's probably around 50 million. 50 million is a lot of money. So we are going to convert ourselves into debt collectors. I don't know how much you'll pay us. So this debt collector you are talking about, how much do you pay?
Chair, the debt collector is paid 18% of what is collected. We define our debt portfolio to some specific customers, probably the age of 90 days onwards, and whenever the payment is made, we do a reconciliation to strictly pay according to what is brought to the company. Thank you, Chair.
clerk is just showing me a letter from Nairobi County where they have outstanding receivables from the national government amounting to 440. This is how much? 442 million. It's a lot of money. So I think we can also send us a letter. You indicate all the receivables from national government because we are soon going to invite them to come and appear before us. Why they are not paying water companies or any other institution entity in the county. So, Honorable Member, I open the floor, starting with the Senator Mbugua.
Maybe the CEO, you've told us what the national government owes. What about the county government? You know, I can start with coming to the governor, and that is the easiest to correct. And also, these 18% which you are paying the debt collector. Is it the county government which is bearing that cost, or the customer who had failed to pay? Because I don't see why you should be burdening the water company, and the offense was on the person who did pay.
Thank you, Chair. The 18% is a cost from the customers, from what is collected. However, the board approved that it's an enticement for us to get that support from the debt collections, since that the more you collect, probably the return is a bit higher. On the case of the shareholder, that is county government, Chair, I want to report that this debt, county government is owing us less than 10% of it, and I want to appreciate my governor, His Excellency, he's one of my highest consumer. Like we have a stadium that is Dinga in Siaya, which is one of my best customers. I know there are issues of disbursement from the National Treasury, but when the money comes, then the money is paid in totality. So I don't have a problem with the shareholder, and thank shareholder for that.
What about the entities we are about to talk to, the hospitals?
Thank you, Chair. In our county, that is Siaya hospitals, also under the same coffer as the shareholder. So anytime we have the exchequer releases, then the payments are paid. Like currently, our hospitals are owing us nearly less than 1% of these payables.
We are a good shareholder. Bwana MD, through the governor, the first query talks about material uncertainty, and it's because there is a negative working capital of 27 million. And you know, negative working capital is current assets minus current liability. Basically means receivables minus payables. So what are you doing from the receivables component to manage the negative working capital?
Chair, the receivables we get, we try to manage also our liabilities in the company. However, Chair, there are some costs which are fixed, and this is actually affecting operations because we have cases like the operational costs. In Siaya, we have issues of turbidity because we source our water from the rivers, and the issues management of the water sources. And of course, the nature of Siaya County, our water company, we have the high cost of electricity, which is affecting us. Most of our pumping stations, you find there are 3 pumping stations. So, and then we are semi-urban. So at the end of the day, the cost of pumping this water is fixed. However, these 2 issues, that is NRW and high operating costs. So the issue of NRW also has to get a reflection on what we are getting in terms of receivables. And the Chair, the auditor is reporting however much we are high above the required standards. We are trying our level best, and that is seen in terms of our management of these net assets. We didn't do well in 24-25 because there was only a reduction of 1 million. But Chair, I want also to appreciate the support of the county government of Siaya, whereby we are now doing the adoption of the green energy, that is solarization. And you can see that probably in pages 3, whereby we have a reflection of the impact of the two schemes which have been solarized and giving that impact in terms of reduction of power bills. However, once that is done, then we are able to manage our payables as has been reported earlier in what we did as at Q2. Thank you, Chair.
Honorable members, any more questions? Senator Kisan?
Maybe from the MD through the governor, how did you arrive at 18%? Because I thought normally agency fees is between 5 and 10. I thought 18% is on the higher side. It should be like 7, because I know also lawyers and the governor is a senior counsel. The fees are normally around 7%.
Chair, we can get further guidance on this. When we were sourcing for the external debt collector, we did an open tendering process, and we got bidders, and they were also putting on their rates in terms of what they are charging, and also trying to do the market survey, what is being also done by our different entities across. However, the recruitment of this debt collector, that was the lowest bidder. That do not mean that we compromise the person who is doing it, but with the confirmation you get that in water sector, most of them are charging more than 20%. But again, through your chair, we can still get further guidance on this.
Now, out of these outstanding receivables, how much is the historical receivables, debts?
Chair, the historical debts also constitute much. Sibbo Water was incorporated in 2006, and this material uncertainty has been ongoing. And looking at the net effect, you find that some are rising due to defiance of customers. Remember, those days there were no proper ways of these issues of tariff, and a number of them are coming through the customer disputes, and probably that's why the debt collector is not taking a lot of doing a lot, because it involves a lot of negotiations so that we confirm. And again, Chair, from where we've come from, and also probably affecting other companies, before there were also even the issues of estimation because of lack of water meters. So you find, and all of them are historical, that somebody probably died, and we really need to get the relatives, try to negotiate, try to bring them back. So that percentage, again, Chair, we can put it at around 20 to 30%.
Any more questions, honorable members? Now, MD, through the governor, tell us about the smart meters. What kind of meters are these? Do they have capability to automatically disconnect customers? That is moving forward. Customers who will not pay you. Do the smart meters give you the capability to disconnect them if they don't pay?
Thank you, Chair. The smart meters is real, at real time. What we are implementing in Sibbo Water is the valve-enabled smart meters, whereby even where you are there, Chair, you can disconnect a customer without even going to the customer compound. And it's working for us. We did a pilot from a section of our customers. Our customer base is around 19,000, and currently we are talking about around 415 smart meters installed from an area which was billing as low as 300,000. Currently, we can report more than 1.1 million. We are looking into that also through the support of the shareholder. However much they are a bit expensive, but there is value for that money because it's real. And again, there is that customer confidence because you'll only get bill of water as passed through your meters, and you can even monitor your consumption strengths real time, Chairman. Thank you.
Maybe at this point I can have a comment from the County Assembly. Just a comment.
Thank you, Chair. On the same, I think we have a report here that maybe my deputy can read it as a comment.
Thank you, Chair. Among the committee recommendations, and I read, it's on our report, page 5. The management of Siaya Bond of Water and Sanitation Company Limited, in collaboration with the county government of Siaya, should urgently implement comprehensive financial and operational reforms aimed at restoring the company's financial sustainability and ensuring continued service delivery. Thank you, Chair.
Any more comments, questions from members? Okay, I think MD and your team, I think this is one area that you need to work extra hard because, as I said, it is affecting the first query, material uncertainty. Material uncertainty, you know, it means that you are in the red. So you need to work extremely hard. I know you have made a good attempt to reduce the debt, but you can reduce it further. As I said, this committee will take an exercise to try and push national government to pay utility bills to the counties like this one. But in the meantime, you need to do your part, because this will help us deal with query number 1 and also deal with the query on payables. Outstanding payables. But on the outstanding payables, which we are not going to dig deep into it, we just want you to tell the committee on the position in regards to Lake Victoria South Water Services Board. How much money are they claiming from you, and on what basis?
Thank you, Chair. On the payables, as was indicated in the query, we get back to page number 9, that 84.6 billion we owe the government institutions, and this figure around 34 is money which is to be payable to Lake Victoria South. Chair, before devolution and probably after the national government, before, Lake Victoria South was managing these utilities, and they were charging some levies which were to be paid to them. Remember, there were also the infrastructure and works development agencies before, and they were the shareholders. So these are figures in our books which are owed, and after the devolution, that is 2013, now the water companies was handed over to the shareholder, that is the county government of Siaya. So, Chair, it's a figure which is claimed by them, and again, through you, Chair, I know the committee can support us so that as an institution there could be some levels of waivers, because this amount of monies are huge, but they are still sitting on our books.
I think that's another area that the committee has agreed to intervene, because the interface between the water service providers and the water regional bodies and the debts, historic debts, we'll be looking at that as well. So honorable members, if no member has an issue, additional issue on that, we will proceed to the matter of excess non-revenue water, which is on page 14 of the response document. Auditor.
Thank you, Chair. Report on lawfulness and effectiveness in use of public resources, excess non-revenue water. During the year under review, the company produced a total of 2,078,420 cubic meters of water, out of which 1,071,803 cubic meters was sold or billed to customers, resulting to non-revenue water of 1,006,617 cubic meters, or 48%, which is 23% above the allowable loss, contrary to Water Services Regulatory Board (WASREB) Schedule E, which provides for non-revenue water level at 20% as good, 20 to 25% as acceptable, while above 25% as not acceptable. The significant level of non-revenue water is an indication of inefficiency and ineffectiveness in use of public and water resources, which may negatively impact on the company's profitability and its going concern. In the circumstances, the management was in breach of WASREB guidelines.
Very well. Excellency, the management response.
With the permission, Chair, would I be in order to defer the reading of the response to my good professor here.
Thank you, Chair. The management response. Management acknowledges the auditor's observation on the high non-revenue water level of 48.43 recorded for the year ended 30th June 2025, which is above the acceptable benchmark of 25% as provided by the Water Services Regulatory Board. However, it is important to highlight that this represents a significant improvement from the 55% non-revenue recorded in the preceding financial year 2023-2024. This denotes a 6.57 percentage point reduction, equivalent to an improvement of approximately 12% in non-revenue performance year on year. Currently, the prevailing non-revenue rate stands at 40% as at close of quarter 2, 31st December 2025. This represents a 15% drop from the 55% non-revenue rate recorded as close of financial year 2023-2024. Chair, on the table we have reflected the rates and the reduction percentages, Annex 8, pages 194 to 195, the non-revenue report for quarter 2. This positive trajectory demonstrates that the company's ongoing interventions are yielding measurable results towards non-revenue reduction and improved operation efficiency. To consolidate these gains and achieve further reductions, management has implemented and continues to strengthen the following measures. 1. Capacity building and non-revenue awareness. In the year under review, the company conducted specialized non-revenue training workshops for technical staff across all schemes. These covered leak detections, pressure zoning, data reconciliation, meter accuracy testing, and customer mapping. This has enhanced internal capacity to identify and respond promptly to both physical and commercial losses. On 2, network rehabilitation and proactive maintenance, the company has identified and repaired recurrent burst-prone sections in critical transmission and distribution mains, notably in Siaya, Bondo, South Sakwa, and Asembo schemes. The repairs have stabilized system pressures and reduced physical losses, contributing to observed 6.57% reduction on non-revenue. On energy reliability through solarization, solarization of production and treatment plants, such as Abura and South Sakwa, has reduced reliance on grid electricity interruptions. This ensures steady water production and pressure consistency, minimizing pipeline depressurization, which is a known contributor to bursts and leakages. On commercial loss control, the company has identified customer identification surveys and meter verification, identifying illegal connections and defective meters. Preliminary data indicates a 5% increase in bill consumption volumes compared to the previous year, confirming improved data integrity and billing coverage. And on strategic monitoring and performance review, non-revenue performance is now tracked monthly through a non-revenue water task force, which reviews production versus sales data, identifies anomalies, and initiates corrective action at scheme level. Management reiterates its commitment to progressively reducing non-revenue water through a combination of technical, operational, and managerial interventions. The improvement from 55% to 40% demonstrates the strategies adopted are both effective and sustainable. The next target is to achieve a non-revenue level of below 40%. The focus remains on strengthening infrastructure integrity, enhancing metering accuracy, staff capacity development, and maintenance consistent supply reliability through solarization and proactive maintenance. Continuous collaboration with stakeholders, including the county government and regulatory agencies, will be pursued to mobilize resources and achieve the long-term target of 38% non-revenue by 2028, thereby improving service delivery, revenue sustainability, and operational efficiency. Chair Annex 8 on pages 194 to 195 as the non-revenue report as at close of quarter 1 financial year 2025-2026. Thank you, Chair.
Very well. Auditor, your comments on the management response.
The improvement of from 55% to 48.3% demonstrates measures put in place positively working, and the subsequent year target of below 40%, as they have explained. We look forward to see the implementation of those strategies so that subsequent losses of revenue can be contained. Thank you, Chair.
Clarity, you can give us the figures for what was non-revenue for 2023-2024, non-revenue for 2024-2025, and now the target, the current one, so that we can see the progression.
So for the current figures are in the report, but for the previous year, I need to open my system here. It will take time.
Okay, so you can do that. Honorable members, Senator Mbugo.
Yes, Governor, assume you achieve this 10% in reduction of non-revenue water, you will have saved about 200,000 cubic meter of water. What is the tariff used so that we can compute that if you save this 10%, the applicable tariff will help us address that issue of the material uncertainty. What is the tariff being used by the water company?
I ask the CEO to respond to that.
Thank you, Chair. We have a tariff structure of 1 to 6 units, and we do around 70 shillings per cubic meter.
Last time you appeared, you did not have a tariff. I think that was one of the queries that was raised. So you now have a tariff.
Chair, we now have a tariff.
That's commendable. So you can proceed and respond to the Senator on the calculations.
Thank you, Chair. I'll request probably the Senator to repeat the question.
The strategy you've given is that you want to reduce this non-revenue water by 10%, which adds up to about 207,000 cubic meters of water. With the tariff you are using, in terms of figures, money, how much will that add up to so that you can address the issue of the material uncertainty?
The Chair, that will add up to around 14 million. And from this reduction from 55% as reported by the auditor to 48, we saw a revenue increment from our average 9, around 15 point something. Sometimes we go up to 17 million. So there's a positive trend because there's a relationship between the reduction and also the issues of billing.
I think what the Senator is trying to say is that you need to peg your target to the 27 million that is in the material uncertainty. So you work backwards. You have a target to reduce 27 million based on the tariff. What then would be your reduction percentage for non-revenue water? I think that's what he's trying to say. That it should not, the target should not be arbitrarily, should be based on the need to eliminate material uncertainty.
Chair, that's noted for action.
Senator Kisang?
Chair, you know, they're doing very well, and the response is very good. In fact, we are discussing here with Mbukwa. Of course, our colleague is there, Professor, and Governor was also a member. You know, when you put people who have been in Parliament to manage the counties, you see better results. The only issue that I have is the last word you read. You said you have improved from 55% to 40%. And your target for the next 2 years is to reduce from 40 to 38. So I thought this must have been a mistake. Did you mean 38 or 28? Because how can you work hard to reduce from? Is this a type of error?
My officers here have already done the calculation. They said you need to target 20% reduction, so that your figure should now come to 28% if you want to clear the material uncertainty.
Yeah, Chair. Yeah, I also thought this long-term target is really long. Yeah, I mean, to 38, 2% improvement in 2 years.
Chair, thank you. The 38%, Chair, was not an error, though it was arising from our strategic plan, which was 2023-2028. That is what was there, and Chair, 2023 our non-revenue water was 58%. So we were giving it in line with the strategy. However, the strategy can be reviewed because in the second quarter, I think the month of
I think there is a problem with the mic. You just need to turn and off.
Thank you, Chair. Like the second quarter, those 3 months, there was a month we achieved 37%, some 38%, but it's been arranging between 38, 39. So, Chair, I'm well guided, and we can review that strategy based on that and by the clerk, so that we work towards the 28% reduction. That's not a Chair for action.
Any more questions, honorable members? MD through the governor, I'm just being reminded here. Have you tried to segment the losses into physical losses and commercial losses, so that now when you're doing your strategy, you know where to put more effort? So how much of this loss is physical and how much is commercial?
Thank you, Chair. The physical could contribute around 60% of it. A number of our schemes have got very edge pipelines. So we can see the physical leakages and frequent breakdowns. However, we are continuing to improve our response unit in terms of their repair. But again, thank the shareholder, that is the county government of Siaya, for some areas they are doing total overhaul. Like in Siaya today, there's a place called South Circle where we realized so many physical losses along the rising main, around 11 kilometers. And the county government of Siaya invested and is doing a total overhaul of that line from PVC to HDPE, and was significantly that will make that scheme to reduce. Before it was over 80%, but currently the project is 80%, but we are recording below 30% loss. So also that strategy losses, but again the shareholder supported us with the purchase of water meters, and we are continuing replacing, and that probably will contributing that effect of the reduction. Reducing from 55 to below 40 within a year is not very easy, but I can report that is attributed through the commercial practices, through the support of the
just for maybe I wanted to find out if the company has done any cost benefit analysis on the investment. Have they done any? Is there any benefit, or what have they done to see if solars they save anything?
MD.
Thank you, Chair. Solarization done, and the county government of Siaya, the shareholder, has seen that our major issue on the electricity cost, and we can attest to that in I'm in Siaya municipality, and we can see a reduction in terms of electricity cost. That is in page number 4, whereby you find 7,000 within a quarter for those two plants. That is the way to go, as much as it is requires a huge investment, but there is value.
Outages, particularly in the western region, and if one had to, rely entirely on the grid, then service now. So solarization does help in that sense.
I think honorable members must have noticed that since if you look at the unresolved prior year matters, then you'll notice that there is progress. Maybe one thing we want to learn from Siaya, which maybe you can tell us, how did you manage to have a new tariff? We are struggling with many counties or the city governor.
Defer to the CEO.
Thank you, Chair. Chair, tariff making process is a concerted effort. Before and accept the transition. Once this transited in 2013, we have to accept that these are owned fully by the county government of Siaya. So in our case, so we involve at that level and also the county assembly of Siaya. That cooperation is there, and we give an open forum, open discussions, real cubic meter of water, and there is that involvement. So that process is long, from the public participation to bringing different categories of customers seated with the shareholder and notice of around 30 days. Then we are free to receive their views, sit again with the regulator and review, so that whenever it is now passed, there is that why am I paying this figure? So that is how we achieved it. That I want to report that it was a shareholder owned exercise. Thank you.
Very well, honorable members, we have one more query, but this query, as directed earlier in our previous the lack of motor vehicle ownership documents. I think that will be covered comprehensively when we invite these people to appear before us. So, honorable members, we will adapt the written responses for the queries. I think about 2 queries that we have not covered. They are not very substantial. Be achieved progressively. So that being the case, that brings us to the end of the examination of this entity. Now the next water people, you can now leave and create space for hospitals. who have just joined us.
Thank you. Chair, I'll begin with the CC member in charge of health on my right. Can you introduce yourself?
Martin Konyango, I'm the CECN for Health and Sanitation, Siaya County. Thank you.
Chair, I'm Dr. Mondi Owino. I'm the Chief Officer Health, Siaya County.
Hospital.
Job Kingsley Otieno, Accountant, Ambira Sub-County Hospital.
Chair Mike.
Thank you.
I'm Evans Omondi, the Accountant, Gotagulu Sub-County Hospital.
I'm Dr. Caleb Otieno, Medical Superintendent, Siaya County Referral Hospital.
Chair, I'm Dr. Don.
Good morning, Chair, committee members. Dr. Goti Evans is my name, Medical Superintendent, Bondo Sub-County Hospital.
Very well, karibuni sana. So, County Assembly, do you have any report which you have processed in the County Assembly? You can share as well. You can table. It has been tabled.
Yes, we have.
Okay. Auditor, I'm going to start with you. You give us a summary of I will give directions on how we are going to examine those reports.
Thank you, Chair. The report Siaya County Referral Hospital. I'll start with the opinions given for the 4 hospitals in terms of opinion. It's report of the Auditor Siaya County Referral Hospital for the year ended 30th June 2025. Report on financial statement was a qualified opinion. Auditor General on Bondo Level 4 Hospital for the year ended 30th June 2025. Report on the financial statements was qualified opinion. On Gotagulu Sub-County Level 4 Hospital for the year ended 30th June 2025. The report on financial statements was a qualified opinion. And report of the Auditor General on Abila Sub-County Level 4 Hospital. Report on the financial statements was a qualified opinion. My overall comment is that apart from the receivables, which is also related to payables, and also there is a conflict between Facilities Improvement Act 2023 with the Siaya County Health Services Act states that the hospitals should retain 100% of the revenue. The Siaya County Health Services Act indicates that the hospital I had my presentation there.
As maybe on that one, which one came earlier? The county legislation or FIF?
The county registration is 2019, the FIF is 2023.
Honorable members, in auditor's notes to you, there are some queries which the auditor has indicated addressed. So because of time, we will not only look at queries which are not addressed, but they are also cross-cutting in all the three entities. And these queries are issues of assets, then we have the issue of long outstanding receivables. I think this has to do with the NHIF and SHA. And then we have coverage, compliance to the requirements of universal health coverage. So we will look at those four main queries. But they will be cross-cutting the three entities. So when you are looking at a particular query, members have an opportunity also to we will look at the report. Our base will be Siaya County Referral Hospital. So
thank you, Chair. Unsupported property, plant and equipment. The statement of financial position, and as disclosed in note 13 to the financial statement, reflects a balance of 164 million. $653 in respect of additions to motor vehicles, Kenya shillings 27,581,600, furniture, fittings and office equipment, Kenya shillings 4 million, ICT equipment, Kenya shillings 1,766,741, plant and mechanical equipment, medical equipment, Kenya shillings 135,298,670, and other assets, plant and machinery, Kenya shillings 19,796,120 valued and recognized during the previous financial year. However, physical inspection of the hospital and review of buildings register revealed several hospital buildings have not been disclosed and values included at a property, plant and equipment. In addition, the LAD at the reference PDP has not been disclosed and value included at a property, plant and equipment, and no ownership document has been provided for audit review. In the circumstances, the accuracy and completeness of the property, plant and equipment balance of Kenya shillings 164,094,314 could not be confirmed.
Thank you. Governor, your management response?
The management response is as follows. Management acknowledges the audit observation regarding unsupported valuation, incomplete disclosure, and note 13 of the financial statements. Valuation reports for additions to property, plant and equipment. The additions to property, plant and equipment amounting to Kenya the financial year was based on procurement records, supplier invoices, delivery notes, inspection and acceptance committee vouchers, in line with the hospital's internal financial controls, and were depreciated and recognized at their net book values. B, and this section, several hospital buildings had not been disclosed or valued under property, plant, and equipment. These buildings are developed over multiple years through a mix of government funding, donor support, and county development allocations, some predating the establishment of the hospital. Historical gaps in asset capitalization during the transition from national to county governments. 2, lack. 3, absence of comprehensive condition and valuation surveys in prior periods. C, 20/211/04, which is approximately 14.945 hectares, acknowledges that the land on which the hospital is situated has not been disclosed and valued under property, plant, and equipment provided for audit review. The land is historically held for public health use and occupied by the hospital as a public trust asset with custody. Mitigation measures and corrective actions. Management has taken note of the audit finding and commits to the following actions. 1, comprehensive asset valuation. To conduct a full valuation of all property, plant, and equipment, including buildings, plant, machinery, medical equipment, and land. 2, asset register enhancement. All property, plant, and equipment will be undertaken. 3, land ownership regulations will liaise with the relevant state agencies and the Department of Lands. Attached, including a confirmation of boundaries, legal status of PDP number 320/211/4, its value. We have annexed a letter to the Department of Public Works, letter to the Department of Housing, and a letter to the Department of Lands.
Auditor, your comments on the management response.
So far, the valuations have not been provided, and the management has not disclosed hospital buildings, neither have their values been included in the PPE movement schedule. Again, the ownership document for the land where the hospital occupies has not been provided.
Very well. So maybe, Governor, you can comment on the status of the other hospitals in terms of these assets.
The other hospitals are really in the same kind of situation. It is a matter which does not just affect hospitals, it affects property. This is partly historical. A lot of the land that we are holding were categorized as public land that was either assigned to the counties, and with devolution, there are areas where we have had problems, not between national government and county governments, but also with communities. This has the effect of delaying either obtaining registration for parcels of land. It's a long process. It involves some element. It is an interest that we speed up the registration, or the registration, rather the registration of this land and property, because some of our development plans and programs have been delayed because of lack of documentation, particularly of land. Some donors are not quite interested carrying out development on land which there's no title, and both levels of government to some extent frown at carrying out development on any land which does not have title, but it's an ongoing exercise.
Honorable members.
Thank you, Chair. Maybe, Governor, on this Abira Sub-County Hospital, I note that there was some correspondences from IGRTC dating back to 2024. Maybe you can tell this committee the progress of your engagement with IGRTC to resolve this issue.
I'm informed that the RTGC was actually at the county last week to try and speed up this process for verification.
Senator Tobiko.
Chair, I think while the governor has adequately responded, unless if the auditors have a different opinion.
Further comments?
From the audits, we'll keep on tracking this issue till the title documents, and also we'll also be checking the balances that are being onboarded in the financial statements in terms of balance, in terms of valuation that is going to be brought forward. Thank you, Chair.
Okay, maybe the main issue here is the assets like building and land, and members from our examination of all the hospitals, we've realized this problem is affecting all the counties, and we said that we will invite the relevant ministries to respond to this, because ownership of land, we've seen in some counties they don't even have a title. Others they have a title but in the name of the defunct local authorities. Others, like in Nyeri, where you have a church owning the land for the hospital. So these are very serious matters which we need to interrogate further. But I think the steps the county has taken, I think is worthy working towards them and getting this matter resolved, especially for non-building and land issues, valuation and all that. So, honorable members, we can now proceed to the next query, which is long outstanding receivables, and we will look at the receivables for got a goal. Auditor.
Thank you, Chair. Long outstanding receivables, Gotagulu Sub-County Level 4 Hospital. The statement of financial position, and as disclosed in note 29 to the financial statements, reflects a balance of Kenya shillings 5,387,573 in respect of receivables from exchange transactions. However, review of the aging analysis indicates that receivables outstanding for a period exceeding 1 year amounted to Kenya shillings 4,601,150. These balances have remained uncorrected for over 12 months, and its recoverability remains doubtful. No evidence was provided to show efforts made to recover them. In the circumstances, the recoverability of the long outstanding receivables amounting to Kenya shillings 4,601,150 could not be confirmed.
Governor, your management response, and as you respond, you can also comment on the receivable situation for the other hospitals.
With your permission, can I ask Dr. Konyango, the CC, of how to
CC
the response?
Proceed.
Thank you, Chair and the committee. I'll read the management response. The audit observation is noted, and we wish to state that the Department of Health has raised several issues with regards to the long outstanding receivable with Social Health Authority, SHA, as per the attached correspondence with SHA. Annex 6, summary of issues raised and resolutions made from the consultative meeting on the implementation of social health insurance report, receivables schedule, and circularization letter to SHA on pending receivables.
Proceed and comment on the receivable status for Bondo and for Siaya referral. You just tell us the amount that you are owed.
Maybe to that specific question, the answer is that for the entire county, SHA owes us 174 million, and NHIF 87 million, making a total of 261 million.
Auditor, your comments on the response?
The receivables, as the response has indicated, is from SHA, NHIF, and UHC and Leader Mama. So I think for me, the county should continue progressively reconciling those revenues in terms of receivables, and institute measures towards correction of the same from the from the institutions that host them.
Yeah, I think in this one we really, again, like the other ones we commented, we need an intervention by this committee because health is a very fundamental service to the community, even in terms of the constitution. And delays of this payment have an impact on how our medical institutions operate. So I would urge the committee that this matter is taken up to impress upon the various authorities running, these services to pay in a timely manner what they owe to the counties, and not just there, but all to the counties.
So maybe Chief Officer through the Governor, I have seen a letter that you did to SHA on the 9th of February, where you are indicating that you are owed 343 million shillings. What is the current position?
Honorable Chair, we have received certain reimbursements from the date when I wrote that letter. The current figure as of last week, what we are currently owed from SHA is 174.
Okay, so you have gotten maybe another 100 million?
Yes, Chair.
Members? Senator Tobiko?
Chair, when we were in Naivasha the other day and we had CS Duale, and he made a presentation on the status of SHA in relation to the various counties. He said there were counties that were doing very well and some other counties were performing poorly in terms of documentation. He talked about quite a number of claims that they are rejecting. So, Chair, maybe Siaya can tell us, or in these various hospitals, what is the amount they have claimed that has been rejected by the authority?
Can I ask the CEO to respond to this?
Thank you, sir. Honorable Chair, initially at the advent of SHA, we had lots of challenges in terms of documentation capacity of the staff that were lodging these claims. We have worked on that and trained the various clerks who are making the claims from the various facilities, and this runs across the level 4 facilities and even the rural health facilities. We've been able to reduce the level of claims which are rejected for lack of proper documentation, and currently the figure that stands which have not been honored for purposes, for reasons of rejection, stands at 21 million. But we are working with the various facilities to provide the proper documentation for these ones, so that they all are categorized as claims that will be reimbursed when SHA is doing their reimbursements to our facilities, sir.
Yeah. For the ones that are rejected, do you have a chance, or is there a window for you to correct the documentations so that your claim is reinstated back into the system and it gets paid, or is it a total loss for the county because you have already offered the services?
we engage with SHA, and where it is identified, for example, that there was improper documentation, a date was not put when a patient was discharged, then we are able to input that and send over to them. The complaint that we have is that the feedback mechanism is not prompt, so that the hospitals they rectify whatever fault has been identified, but getting back information that this has now been sorted and it will be paid, there is a delay there.
Senator Mbugu.
Governor, during the same retreat Senator Tobiko was talking about, the Cabinet Secretary told us that they have verified the NHIF claims, and probably they have communicated with all the counties what they have verified. Maybe you can tell this committee how much was verified for your counties, and they indicated that the facilities which are owed less than 10 million, they are in the process of paying. And I'm looking at a letter written to you on 7th March 2025 from COG, where listing the NHIF money which is owed. And for Siaya County, I'm only seeing Siaya County Referral Hospital, the document you've attached. Maybe the other hospitals, the other facilities within Siaya, they don't have pending claims for NHIF.
Your permission, can I defer to the CEO?
Through the chair, we have all the facilities that were benefiting from the NHIF scheme have pending claims that have not been honored by SHA. Pending claims from NHIF.
Senator, use the mic.
Sorry. What you've attached, you are only showing Siaya referral. You are not showing the other facilities, your own documents.
My apologies, sir. That I think we attached that in respect to the document we were presenting for Siaya County Referral Hospital.
Any other issue, Auditor? Further comment?
Chair, I think the rest of the observations you can in your wisdom you can consider the responses submitted.
So just honorable members, we agreed that we will invite the CS for health to appear before us, because these delays in reimbursement of SHA have the potential to bring down our hospitals. They have a serious potential. I would like to get a comment from the County Assembly on this particular issue.
Thank you, Chair. I think we have the same recommendation that we have also advised, because previously the facilities didn't have the accountant, but we have also advised them that they should be having qualified people. Also, we have also advised that the MedSoup should not be the accounting officers, because sometimes they're busy in the theater. They need to have the administrators to do this, so the smooth running of the facility can be seen.
I think you brought up a very important issue of having accountants in these hospitals, because there's huge amount of money there, and I think the auditor has raised some issues around there, which auditor, you said you will look at the reconciliation in the next financial year. Is that the case?
Yes, Chair.
So any more comment on that? Okay, we can proceed to long outstanding payables, and our base is going to be Bondo level 4 hospital.
Thank you, Chair. Report trade payables for Bodo Level 4 Hospital. The statement of financial position and as disclosed in Note 36 to the financial statements reflects trade and other payables of Kenya shillings 8,789,903. Analysis of trade payables ledger provided for audit revealed that the hospital owed KEMSA Kenya shillings 2,240,000.
Which one are you reading?
Bondo Level 4 Hospital, paragraph 4 of the report.
Sorry, I was looking at Ambira. Can you give me the... Just proceed.
However, documentation supporting the debt owed to KEMSA and the aging analysis were not provided for audit review. In the circumstances, the accuracy and completeness of the balance of Kenyan shillings 8,789,903.4 in respect of trade and other payables could not be confirmed.
Governor, your response?
Ask the CC for help to respond.
Thank you, Chair and Committee. The management response, I read, we note your observation and wish to state that the supporting documents to show debt owed to KEMSA totaling Kenya shillings 2,214,511 are now available for your verification. The payables aging analysis report is also available for your review. There are annexes, Annex 3, payables, aging analysis report, and invoice, delivery notes owed to KEMSA attached.
Auditor, your comments on the response?
So the aging analysis has been provided, the invoices have been provided, so the issue is addressed.
But at what point was it provided? Why was it not provided during the audit?
Yes, Chair, that is the matter for concern because these were provided during the responses to the Auditor General's report.
Senator Eddie Okech, Vice Chair, introduce yourself.
Thank you, Chair. And I think now is afternoon. Good afternoon to you and the committee. And good afternoon to Governor, together with your team. My name is Eddie Okech, member of this committee and the Vice Chair of this committee. And not sure whether Linda Ground or Linda Mwananchi has got membership, but maybe you'll advise after this, so that now that membership is membership, we can be able to see. But I welcome you.
I can assure you we are on serious business now. But you can ask that question outside. Okay. So any question?
Looks like he is on the way.
Any question, Senator Mbugua?
Yes, Chair. On the payables for Siaya, there is a payment plan, Governor, which you annexed, Annex 5. Maybe you can tell us, because it was ending in 2025, but maybe you can tell us whether you are able to do the payments as you had planned in this payment plan, Annex 5 of Siaya Referral Hospital.
The CEO has an answer to this.
Chief Officer.
Thank you, Chair. the payment plan for Siaya County Referral Hospital that was ending in 2025 was honored. But I wish to add that indeed we still have quite a bit of pending bills running across the various facilities, and this chair ties to the previous question about what we are owed by both SHA and NHIF. Totally, our level 4 hospitals have outstanding pending bills of about 127 million across the 10 hospitals.
Chair, on the same query, the auditor noted that there was no explanation given for the increase in the payables within that period. So if you honored, then why was this increase noted by the auditor of, I think, is it from 21 to 36 million within the same period?
Through the chair, as the facility collects money and receives money, the reimbursements, we try to do the first in, first out. So the facility is still incurs costs as we offer services. That is why the amount would still appear to be increasing, even though we sought the long-standing payables.
So maybe you need to tell us what are you doing about these schemes payable? Is it affecting your supply chain?
Chair, we treat KEMSA as our preferred supplier in Siaya County. We try to address whatever pending bills that we have, so that the debt does not go beyond 120 days, and that is how we remain in their good books. So we pay what we owe them, but we still order once we are in the green with them. We still order more commodities from KEMSA.
Maybe you also need to give us the payable situation for the other hospitals.
Chair, I can go individually for the other facilities, but I did mention, sir, that across our 10 level 4 hospitals, we currently have an outstanding pending bills of 127 million, sir.
For all the hospitals?
For all the level 4 hospitals in Siaya County, sir.
So what are you doing about them?
Sir, on our part, we do the aging analysis, so that as we receive funds, we try to address the oldest. But as our governor did mention, and the request that he put to the committee, if at all SHA and SHA can settle what we are owed as a county, then indeed, if you compare the total figure, what we are owed 261 versus what we owe, which is 127, we would as a county be able to offset all that we are owing our vendors and suppliers.
Any more question, comment?
Chair.
Yes, proceed.
Chair, for me, I think when the county is old, I feel age. But when county owes somebody, and that person is not perhaps very keen on getting their money, I feel okay. But that said, I would want to understand whether this payable to KEMSA has hindered any services in terms of getting medical supplies to the hospital in any way.
Through the chair, while KEMSA is the preferred supplier, there are times when certain facilities are not able to pay within the 120 days. So then they are not able to make an order to KEMSA. In such a case, then for the commodities which are needed, they would go to other pre-qualified vendors, including meds and others that have been pre-qualified by the county supply chain management. But we still insist and impress upon all our facilities that payment to KEMSA and being able to be on the good books of KEMSA is a priority right from the county level.
Chair, that's a very clever answer. Just hold everything constant. Ceteris paribus. If you hold anything constant, no any prevailing circumstances, has there been hindrance of service just because KEMSA is looking for this money? You're giving me a conditional analysis that should there be problems aside of KEMSA and whatever, you can look for other vendors. No, I'm just talking about just as a result of this pay. Have you had any confrontation with KEMSA?
No, we have not had a confrontation with KEMSA, and services have not been hindered. But from management point, anytime when we are not able to, when a facility like Bondo is not able to get commodities from KEMSA and they get it from another vendor, then they may get it at 1 shilling more. So from management point, that is the problem.
Yeah, Governor, this chief officer understands his role very well. From the way he's answering.
I'm lucky that in this department, they're all doctors, including the CC member, Dr. Konyango, who has worked with the UN and been at some, posts worldwide. I just did see him salute the chairman today when he entered.
Thank you. Any other comment on that? Okay, honorable members, we proceed to the query on UHC, and we'll go for the big hospital in the county, the Siaya referral. Auditor, you can take us through deficiency in implementation of universal health coverage.
Thank you, Chair. Deficiencies in implementation of universal health coverage, UHC, Siaya County Referral Hospital. Lawman number 1 is a service delivery gap. Review of hospital records and interviews with management revealed that the hospital has 14 medical officers against the required 16. 0 and is the serologist and radiologist against the two for each category, and 1 pediatrics against the required 2 as tabulated below. So there is a table there, staff requirements, the 4 standard number in hospital, and the variance and the percentage. So for medical officers, there is a variance of 2, and the serologist variance of 2, pediatrics variance of 1, and radiologist variance of 2. In the circumstances, the hospital may not be able to discharge its mandate as a level 4 hospital, which hinder the realization of universal health care objectives. These deficiencies contravene the first schedule of the Health Act 2017 and imply that accessing the highest attainable standard of health, which includes the right to health care services, including reproductive health care, as required by Article 43(1) of the Constitution of Kenya 2010, may not be achieved.
Very well. Governor, your response?
Can I ask the CC to respond?
CC.
Thank you, Chair. Management response. Deficiencies in implementation of universal health coverage, UHC, service delivery gap. Management acknowledges the audit observation regarding staffing gaps affecting the hospital's ability to fully meet the service delivery requirements of a level 4 health facility as stipulated under the first schedule of the Health Act 2017. A, context and contributing factors. Management notes that staffing levels are influenced by a combination of systemic, physical, and labor market dynamics, including attrition through transfers, resignations, and study leaves. B, impact on service delivery, UHC objectives and mitigation measures. We acknowledge that the staffing gaps pose potential risks to optimal service delivery and the full realization of universal health coverage objectives, but have put in place interim service continuity measures to mitigate the impact, including 1, italic, task sharing and optimized deployment of available clinical staff, notably among anesthesia staff. 2, italic, referral of specialized cases to higher level facilities where necessary. 3, italic, engagement of visiting specialists and part-time consultants where skills transfers and specialist interventions occur, e.g. the surgical in-reach camp. 4, italic, telemedicine, for example, through remote CT scans reporting, maxillofacial surgeon, ENT surgeon, dermatologist, audiologists, renal and cardiology clinicians. These are represented by Annex 7, which is the extract of surgical camp program guide, CT scan reporting agreement, H-code brochure.
Auditor, your comments on the response?
Yeah, the management has not yet fully complied with the health policy guidelines, and we have commented on their prioritization on recruitment or secondment of the specialists, the ensure infrastructure documentation of land as required by Kenya Quality Medical Health standards, and develop and implement a UHC readiness plan aligning it to Kenya Quality Medical Health standards, and also establish a monitoring mechanism to ensure continuous compliance with the standards. Thank you, Chair.
Chair, if you may allow me to add, we have got an ongoing recruitment exercise where we are trying to recruit more than 100 medical personnel. The interviews are ongoing, and I think at the end of that exercise, most of these deficiencies, as exhibited in the table on page 20, will be fully addressed. But that is work in progress. It does not take away the very legitimate concerns of the auditor.
Auditor, in your query, you seem to have only mentioned expert medical personnel, the doctors, medical officers. Does it imply that we have sufficient nurses in this hospital? Because you didn't mention anything about the nursing staff.
Chair, the report as it is, the way that bit is not there, but for nursing, Kenya registered nursing, I think I need to refer back.
To make full disclosure, we have indeed shortfalls, nurses, clinicians, and as I have said earlier, those are being addressed in the current recruitment exercise, which should be complete within a fortnight.
Senator Ogwa.
Thank you, Chair. You know, Chair, many governors have appeared here and they have been telling us they cannot get these professionals. And we know Siaya is a supplier of these professionals, so the governor cannot escape because they are readily available, because most of them come from there. But Chair, I think even we should have gone to this hospital called Gotaguru, because if you look at the table, Chair, the percentage of the staff which are supposed to be required who are there, who are lacking, is 89%. If you look at the services which are being offered, there is no surgical services, no pediatrics, radiology, renal services. Actually, Governor, this makes us wonder, is this hospital really operational, looking at this table from the auditor? Maybe, Chair, you can go to page 14 of Gotaguru. The deficiencies there are glaring. Page 14 of Gotaguru.
Page 14.
Starting from page 13,
So maybe in light of what the governor said, the recruitment is ongoing. Maybe the governor, you can tell us, in that recruitment, are you going to prioritize this hospital? Because the auditor has given variances.
Yeah, indeed that's the case. This hospital is a center of focus because of its situation, its geographical situation. It is at a point where people requiring these services find themselves in a very difficult position with transport and the like. So in the current recruitment drive, we are targeting Gotagulu Hospital as a major area of interest, and I think within 2 weeks or 3 weeks we can report back and to this committee to demonstrate that we have not fully but substantially dealt with these variances. But I quite agree that we don't have fully the people that we require. But when you look at in terms of brick and mortar equipment and theaters, I think we have them in place. What do we need other personnel?
Auditor, you didn't give us a picture of equipment and machines at referral hospital. Does it mean that you were satisfied with those equipment, that they met the standard? Because in the query, you did not make a reference to equipments and machines.
Chair, the governor has just said, in terms of equipments, machines, they are fairly okay. And I can see on the same page that Senator Mbuko was referring to, page 14 of Gotaguru. The incubators for newborns is 0. So if there was such a need, and I believe such arises, the hospital has no incubator.
Auditor, please.
Chair, we look at the issue in the subsequent financial year.
So you are saying it was an oversight on your side?
No, Chair, because the report as it is, the observation is not there, meaning the issue could have been addressed during the audit.
Maybe I can come to Governor, you can make a comment on what Senator Tobilo has raised.
I think essentially what the auditor is saying is correct. But if you look at the interventions which are ongoing, if the auditor comes to on site in another 6 months, the situation will be very, very different from what you are reading from your table. So I ask the committee that we can give a situational report on the situation at Godagulu. It's a fairly new but very far-flung institutions in the county. But in another 6 months, I think we'll be in a good place.
So I think we are going to, just like other counties, we'll make an inspection visit to Siaya, and we will look at some of these issues that auditors raised. Any other query or comment, honorable members? Control of budget. I can see you are raising your hand.
Yes, Chair. I don't know if the committee is still looking at the hospitals or you have closed. I wanted to bring...
No, we are still looking at the hospitals. So I think one other issue that I wanted to comment on, which I've seen the county has actually resolved. The last meeting we had the issue of boards, the hospital boards, and the auditor, you have reported that the matters were resolved. Yeah, so maybe I would want the governor to comment on that. The hospital boards.
I think we have now had reports from all these hospitals. They have been trained, they have been gazetted. So I think we are in a different situation compared to the last time. And normally these boards have to get approval of the county assembly. And I can confirm the county assembly gave approval to the boards that we have established in all those hospitals. Very well.
So I think
maybe Chair.
Yes.
Just a comment. Abira sub-county level 4 hospital is only a hospital now which have not established a board of management. Maybe the management can comment on it. Failure to establish a board of management. Abira sub-county.
So maybe Governor, you can comment.
We have a board.
You have a board.
Gazette.
So maybe you can supply the Gazette notice to the auditor so that he can clear that way.
That's a place where I went to school, so
yeah,
I know the visit.
Yes. County Assembly, do you have any comments on the hospitals?
I think much we have discussed on the same, and at the hospital they are really now improving on, because our recommendations go the same. We go to the hospitals, we see how they are improving. Like the boards we're talking about, we have done them already. I think everything is in place. We are trying to make them improve.
Okay, I think there is an improvement again, just like water. There is an improvement, but we will be on site after April to come and see for ourselves. So, honorable members, I think that closes the review. Proceed.
Thank you, Chair. I wanted to bring to the attention of the committee the issue of implementation of FIF. If we look at Siaya Hospital, there is a query on non-compliance with FIF. And this is an area which the control of budget is also interested, because we report on, like in this financial year, they did not meet the target. They were at 70%. Maybe non-compliance with the FIF Act is what is causing them not to achieve the target. And the committee is in a good place to advise on the implementation, considering their act is in conflict with the FIF Act, where they are sharing revenue, and yet Section 5 of the FIF says that there should be full retention of what is collected in the hospitals. That's what I wanted to mention.
But you remember that issue came up with the Kilifi and I think another county where they have an arrangement. I think even Moranga, we have a county legislation and we have the national legislation. And I think we directed that the legal officer, you give us an opinion on that. So maybe before I allow members to come in, legal officer, you can comment on that.
Chair, just want to give you an update, and then maybe the officer can
proceed.
I've chaired I think 3 meetings this week.
Yes.
Where we had the same issue. The misnomer comes from section 7 of the FIF, because section 7 looks at the functional allocation of the resources that are retained there. So I think that is where most counties were exploiting to perhaps defy section 5 that the COB is talking about. So Chair, I think that the rule of the thumb should be, we need to be stringent on section 5. Once we see on section 5, any law that then violates section 5 then becomes inferior to FIF. Because otherwise, if you pick piecemeal, elements of section 7, that, oh, this one we want to go and do with it administration here and there. We had a case for, I think it was Samburu, that was being very cagey with some programs that they want to do. Then it becomes defeatist, because then you will just have people like getting 2%, then it will be 3% to do another function in the departmental area, in the ministry, in the ministerial side of things, that then eventually you just claw back in the entire act of the entire FIF. So I don't know, but I think that we should not allow the exploitation of section 7, because there is a bit of section 7 that could talk about some functional elements that then goes to the departmental area. My recommendation as I finished here was this: if those elements of section 7, I think the legal will read them, can be implemented within the hospital, then I think it's fine. So if there are some administrative element or community engagement elements which you will read, that need to be implemented, why can't you just retain the money in the facility and conduct that function in the facility, rather than taking a portion to go and do that function in the ministerial level? Chair, I yield.
Let me hear from our legal, and then I will come to the moving constitution.
Chair, that sounds like there's some bias. I think it could be an Mwananchi bias, principles among themselves, but it's okay.
Proceed, legal officer.
Thank you, Chair. Through you, Chair, when you look at FIF, that is Section 4, the application of FIF, it applies from level 1 to level 5 of all public health facilities. And then when you look at our constitution, that is Article 191 of the Conflict of Laws, whereby under sub-article 2, the national legislation prevails over county legislation, where the national legislation applies uniformly throughout Kenya, and any of the conditions that are specified in clause 3 are specified, and that the national legislation is aimed at preventing unreasonable action by a county that is prejudicial to the economic, health, or security interest of Kenya or another county, or impedes the implementation of the national economic policy. And then through you, Chair, as the Vice Chair has already said, this act applies uniformly throughout the country, so ideally it tackles the issues of health across the country, so it applies from level 1 to level 5 of all the public health facilities. And then there is the issue of retention of all the monies raised by public health facilities, and that is under Section 5 of FIF. Under subsection 2, it states that there shall be opened a facility improvement financing account for each public health facility, into which shall be paid all monies received by or on behalf of the respective public health facility. And then, Chair, the issue of the uses of the finances that are retained by the public health facilities is handled under Section 7 of the same Act, whereby the finances that are retained by the public health facilities are used to A, support the respective public health facilities' optimal operations for effective service delivery throughout the financial year. B, subject to applicable financial laws and regulations, ensure readily available financial resources for the purchase and acquisition of urgent goods and services at the respective health facility. C, enhance where applicable the accessibility and predictability of finances for procurement of essential products, commodities and technologies. Ensure that health services are available, accessible, acceptable, affordable, and of good quality and standard. E, guarantee that health facilities are optimally resourced to offer quality care to all patients. F, facilitate primary health care and preventive services at the community level. G, sustain daily operations and promote improved access to health services to all residents in the Republic of Kenya. And H, to fund ambulance services for the transfer of patients from one health facility to another. So ideally, Chair, from the reading of the Act, it would mean that all the money that is received or from our public health facility should go back to that health facility, Chair.
Very well. Maybe I'll get a comment from Governor on that.
I think the matter is not as easy as what has just been said and what I've heard. I think as a matter of interpretation of the law, there are several principles that must be applied, including that the basic structures of government as underpinned in the Constitution should never, through an ordinary legislation, which is the act that you're referring to, should not be weakened. Those structures should never be weakened. But the more important, and I'm not saying what I'm saying is the correct interpretation, But this is a fairly elaborate provisions of law, and it says the national legislation prevails over county legislation if. Now, there are a lot of parameters to look at for that legislation to prevail. And I want to say that I'm not convinced that if you look at the if, which is provided in Article 199, sub-Article 2, running to B, and then looking at the sub-Article 3, the conditions, which are the conditions referred in Clause 2A, and in its entirety, if you look at it, I think the situation is more complicated than it looks. I think a proper reading and interpretation and looking at the structure of the Constitution, any legislation that tends to take away the architecture of the Constitution as establishing national government and national institutions, the county government and the institutions. Otherwise, this kind of legislation, I must say, are the backdoor processes in which national government is clawing back on devolution. How counties organize themselves, what money is to retain, should be left upon on their judgment as enacted by the county assemblies. Otherwise, I think there will be a threat to county governments. I think we can also, think on the other side of the coin that there should be county legislation which prevail on national legislation if that legislation has the effect of taking away the constitutional role of the county governments. So I am not arguing either way, but I'm saying it's a very complicated part of the Constitution, the conflict. My brother knows there that the conflict of laws is a very complicated subject in either international law or domestic law. There cannot be any easy answers. And looking at this section, I think it is important that we have a fully a proper interpretation, and maybe this is something which probably we should seek advice with the Attorney General on the part of national government, and we as counties can look for our lawyers here who can have a different interpretation. So I think we should seek a more elaborate interpretation. And now the thing, I would, if I was confronted with this subject as a major issue, I would have given up a more thorough opinion on this. But the danger is looking at what has happened in the last 15 years. The danger is that the national government is by legislation, which includes the creation of authorities like KENHA and KURA. They have invaded responsibilities of county government. So simply because there's that national legislation does not mean that's the correct position. I think we should look at the Constitution and the rules that are set out in the Constitution as assigned to counties as opposed to national government. So before we can say our national county assembly is wrong, I think we need a more thorough determination of this subject.
I don't want to make it like a debate because I think we had earlier on directed the legal officer to engage the legal department to give us a legal opinion. Then a committee based on that legal opinion, they can know the next steps they are going to take.
Chair, I get that, but I think that laws are not made in vain. I don't think laws are made in vain, because I think FIF has come at the backdrop of a number of interactions with county hospitals that were not able to function because of cash flow issues. And that cash flow was not necessarily the lack of resourcing by county government in the budgetary instrument of the county government, but it was because of the complexities that hospitals needed to go through back and forth. For instance, resources had to come from these facilities, sometimes go back to CRF, get an allocation matrix. Yesterday I was dealing with an issue here of serious resourcing for SHA for, I think it was still Samburu, for those who were here yesterday, and just a misnomer of 9 million moving back to Samburu CRF last year. For them to get back that money, there has to be an instrument of budgeting in the next financial year, or where there is a supplementary budget to it. And then you find that all the functions that that hospital was supposed to do within that entire year cannot happen because of that architecture of the law. So, Governor, I think that there also need to be goodwill, even by COG, that overall, if 80% of a law is good and is serving the purpose of being able to enhance the cash flow element of hospitals, I think we should support it. Because otherwise, then we defeat the element of service provision, because that is the end game of any law. And Governor, I remember when you appeared here last year, we talked about even the municipalities. The question was, is our municipalities a government on their own? And we established that the spirit of the law was not to make them a government. The spirit of the law was to make them an agency to you as a government to be able to deliver service. And that's why that autonomy that was being given to municipalities would then do exactly that, enhance one service, and where there is more revenue generation than was anticipated by the county government, then the agency status comes in to propagate the idea of getting more revenue for your own source revenue from the same municipality. So while there could be technical arguments around which law versus which law is superior, I think the core of the issue here is the need for that law. What necessarily the coming of that law, what problem are we trying to resolve? And that problem, I think that what we have seen in a number of counties that have implemented FIF, the truth is that they are actually becoming more functional in terms of service delivery in hospitals, and more importantly, some have even moved from just idea of service delivery to increasing revenue in those hospitals that are at the benefit of the county. A good case in example is Kisi. We have seen like a serious increase of revenue and a serious increase of service. So while we're still solving that misnomer of which one is superior, Governor, I'm not a lawyer, but from a business perspective and economics perspective, I can argue the case for service delivery for our people, which is what this act sought to enhance. Just a feedback on that, Chair.
Just allow me just to say this, there's this general assumption that national law prevails upon county legislation. Yet the Constitution contemplates circumstances where county legislation prevails upon national legislation. And that is clearly stated in the Constitution, that in 191(3)(4), it states county legislation prevails over national legislation if neither of the circumstances contemplated in clause 2 apply. And then 5, in considering an apparent conflict between between legislation of different levels of government, a court shall prefer a reasonable interpretation of the legislation that avoids a conflict to an alternative interpretation that results in conflict. Then 6, a decision by a court that a provision of legislation of one level of government prevails over a provision of legislation of another level of government does not invalidate the other provision. So what we're saying, even if the court determines that the national legislation prevails, but it still does not invalidate, the legislation, the county assembly legislation. So as a matter of law, it is not an easy case to deal with. You've got to read this law in a wholesome manner. But I can understand why you are looking for a purposive interpretation of the law. You know why you want to get to. Read the law to get to there.
Chair.
But I think it's a little more complicated than
okay, as Elia said, I'm not also a lawyer, I'm a computer scientist. But this particular FIF Act, the money actually is retained at the facility to enhance services. There is nothing that comes to national government. So it is basically a law that has been done by national government, but it's entirely being implemented at the county level. So it's not, they are not going back. It's only that maybe, as a lawyer, as you said, maybe you need to seek some interpretation from Attorney General, or you can go to court.
So, but you see the county, the other side of it from the county legislation is if you have a facility, a rural facility, for example, a dispensary that does not have any income, it does not get SHA, it does not get NHIF, how does it operate? So the county legislation was, good in the sense that it was saying, you got to look for, some income or financial input for the dispensaries and the health centers as opposed to the hospitals.
Yeah, the governor is right, could be right, because maybe a particular sub-county, the clients to that particular sub-county, they are dispensaries and health centers that, they refer patients to the sub-county. So this particular sub-county hospital that is having FIF then needs to support. Yeah, that's how maybe.
Actually, that is the essence of the revenue sharing for all the counties.
Yes.
That the share, the 10% or 20% goes to support those low-level hospitals. And I think there is sense there. That's why we directed, just for us to know the way forward, our legal division to come up with a proper opinion. Then this committee can see how to intervene. We can either amend the law or make some steps towards addressing the problem.
Through you, Chair, maybe with your kind permission, there is also that under that section 5 of that FIF, under subsection 4, there is the issue of where the income and other receivables that are retained by the public health facilities are considered as supplement to the budget and resources appropriated to the public health facilities by the respective county government and not a substitute. And then when you look at the section 6 on the sources of the public health facilities improvement financing, it talks about what is retained, that is under subsection A, and then there is also paragraph B rather, on the money that is appropriated by the county government to the health facilities from the equitable share. So maybe we can get the views from the senior council on the same, because it seems like under the FIF there is the issue of the budgets that now the counties have to give to those
public health facilities apart from their own source revenue. Thank you, Chair.
Yeah, I think we'll be labeling this for long. We need to move forward. I think the governor has a point, because a number of governors have appeared here and have complained about, for instance, this is a level 5 hospital, which probably could be the primary revenue catcher among all the hospitals. This could be the biggest in Siaya, which is understandable. So I get it when the governor says that there's a possibility that, you know, you needed some, even 10% or 20% to be devolved or decentralized from this particular hospital to go and do some primary health care issues in the ground. I think that's a valid conversation. The only thing is that it is still difficult with the law, but the laws, it is us who make the law. So as you implement this law, and maybe this was not foreseen when we were making this law by the Council of Governors, these are crucial feedback that can form a basis for amendments, and it should be forwarded so that it is smoothened and allowed to to make it easier for governors to actually get some resources directly from some of these most performing institutions. I think it's pretty straightforward.
Okay, so I think the direction on legal opinion still stands. Legal department will give us an opinion, but for now, control of budget, I think you have listened to the conversation on that matter, and the auditor also. I know you sometimes strictly follow what the law says, but you can see the challenge that we are having. So meanwhile, we'll wait for the opinion to come, and then we'll make a decision. So that brings us to the end of hospitals. We now have 2 funds. It is already 1 o'clock. So I hope we are going to end by 1:30. So we can have the officers of funds coming in. You can assist us in identifying the officers who have come in for the purpose of...
Thank you, Chair. Beginning with the CC in charge of education, can you introduce yourself?
Thank you, Chair and committee members. I'm Dr. Edgar Otumba, CEC member in charge of education, youth affairs, gender and social services at the county government of Siaya.
Thank you, Chair. Honorable members, Richard Ogeda, Chief Officer in charge of education and training, county government of Siaya. Thank you.
I'm Christine Odhiambo, Administrative Officer, Department of Education. Thank you, Chair. My name is Zilpa Menya, Director, Executive Affairs.
Thank you, Chair. I'm Irene Owiti, the Accountant, Department of Education, Gender and Social Services.
I'm Opio Stephen, Direct Education and Training.
So I think we'll go straight on to the auditor. You can make a brief report on the two audit reports, and then I will give direction.
Thank you, Chair. The report of the Auditor General on Siaya County Basary Fund for the year ended 30th June 2025. Report on the financial statements, a qualified opinion. And the report of the Auditor General on Siaya County Climate Change Fund for the year ended 30th June 2025. Report on the financial statement is qualified opinion. My comments on Basary, Siaya County Basary Fund. The bigger issue is the going concern of that fund in light of the control of budget directive on funding of bursaries by the county government. And that is the issue that have not been addressed, and also non-disclosure in notes of some, in terms of transitional issues, and an issue on unresolved prior year matter. So on Basary Fund, those are the three issues. That is the going concern due to that effect of the control budget directive, the issue of unresolved prior year matter, and also compliance with transitional issues. On Siaya County Climate Change Fund, there are several issues, and here majorly the county have not complied with financing locally led climate action registration, and in all there were there were 12 issues, and 11 were not addressed and 1 was partially addressed. Yes, and this one, it has a lot of, those of them 11 were consistent with the previous year issues that were listed. Thank you, Chair.
Very well. So we have the two funds before us. I think because of time, we will look at the bursary, and then the climate change, we are going to retreat and look at the written responses. If we need to get clarification from the county, we will contact the county to give us clarification. I'm even told that the administrator of this fund is not around. So we will only retire at the bursary fund, but this one, members, we are going to retreat very quickly to look at the written responses. So Auditor, you can take us through the major query on bursary is query number 1, which is material uncertainty on sustainability of service. So you can proceed and read the query.
Thank you, Chair. Material uncertainty on sustainability of services. The statement of comparison of budget and actual amounts shows an amount of Kenya shillings 1.4 million on transfers from county government being Kenya shillings 90 million under recurrent, Kenya shillings 44,000 under development, 44 million under development expenditure. Review of budget approval and disbursement documents revealed that the whole amount of Kenya shillings was at 4 million was approved, but the amount was not disbursed. No No official communication, correspondence, or explanation was provided as to why the funds were not disbursed. In addition, it was noted there is no budget for any receipts and expenditures in the subsequent financial year 2025-2026. The non-disbursement of the amount of Kenya shillings 134 million caused a significant doubt in the Siaya County Basary Fund's ability to continue to sustain its services, which was not disclosed in the financial statement.
Governor, your response?
If you allow me, Chair, I'll ask the CC in charge of education to respond.
Thank you, Chair. Management response, we note your findings and wish to clarify that Siaya County Basary is dependent on disbursement from the County Revenue Fund with approval from the Office of the Controller of Budget. Every financial year from inception, Basary Fund has been allocated funds and disbursements has always been done to the fund within the financial year. During the year under review, it was budgeted and requisitioned, but was not approved by the Office of the Controller of Budget because of legal issues as per the attached circular reference COB/CIR 002 volume 2 dated 14th January 2025. The Office of the Controller of Budget indicates that for counties to legally undertake this national government function, there has to be a transfer of the function to the counties in accordance with Article 187 of the Constitution as read together with Intergovernmental Relations Act, Chapter 265F. The county did not budget for receipts and expenditures in the subsequent financial year because of the existing legal issues raised by the Office of the Controller of Budget. We have attached the circular dated 13th October 2025, reiterating that functions of the county government was provision of education support /Basary. Thank you, Chair.
Auditor, your comments on the management response?
There's no evidence indicating the continued disbursement of the funds in the subsequent years.
Control of budget. Your comments?
Thank you, Chair. And just to say that these are matters that has appeared before this committee many times. And of course, because of the circular that we issued and the matters before court, the counties that were interested to continue to issue bursaries were required to sign an agreement between the Intergovernmental Relations IGTRC, yes, together with the ministry. So they continue to issue bursaries as long as that agreement was in place. So I don't know for the case of Siaya if they didn't seem it fit to go into that agreement or what happened. So I would also want to know if they have an agreement already, and if the Controller of Budget still insists not to approve funds to them, then it's a matter I can follow up.
As we speak now, we have that agreement signed between us and the Minister of Education and the IGTRC. So there's a valid agreement of transfer of functions. So we should be able to operate the bursaries. But in the current financial year, because of this legal hurdle, the monies that were originally budgeted for the Basary Fund, they were reallocated through a legal process where these amounts of money were used in other things in the budget.
So any question from members or observation or comment?
The Chair. So basically it means because of that issue, the governor reallocated and he has done other things for the county. So, but this is a benefit that will really assist the poor. I don't know if he has intentions to budget for 2026-27 so that at least, the poor from Siaya County, because I know there are poor people everywhere. because some of us went to school because of missionaries. But now that we have money at the counties, they should be able to assist the poor.
Yeah, we are going to budget this. Even from the county assembly, I think they probably would comment on this. The non-operation of this account for bursaries was a matter they did not take very lightly. But having resolved the issue with now the controllable budget, in the sense that we have now signed an agreement, we should be able to provide for those who are entitled to get these bursaries.
Senator Mugwa.
Thank you, Chair. Maybe Auditor, related to that query. In the other query, you queried about the unsupported allowances and some discrepancy in money given. And yet the governor is saying money was not put into this account. Then what was happening? Were there still meetings happening and still the disbursements which you are querying that they were not supported? Where was money coming from if the entire amount was never transferred to this fund?
You're making reference to prior year issues. Maybe it's a prior year issue. That's for 2023-2024.
Yeah, I get it.
So maybe on that, I just allow the auditor to make a comment on prior year issues.
On prior audit matters, on some prior year matters have been resolved. However, we are still waiting for the status report on implementation of the oversight recommendation by the fund.
Okay. Maybe at that point I can allow the county assembly to make a comment, a general comment on the bursary.
The issue has been very thorny actually in our counties, but since now it has been resolved and have been signed, we are happy for that, and we expect now to give more education to our people. Thank you.
Yes, I'm being asked by my clerk that we will comment on the issue of the tenure of the fund. The period is a period of 10 years is expiring. So, so what arrangements have you put in place?
I think that matter having been brought to our notice, I think the county assembly is well placed together with us to look at this legislation which is here, and I can assure you that they will not hesitate to renew the fund in terms of the tenure which is spelled out in the County Assembly Act.
Honorable members, any further issues? I think that brings us to the end of Basary. As I communicated, the matter of the climate change will be handled internally, and in case we need further clarification, we will do that. So we'll now go to the closing remarks. Any member with a closing remark?
Senator Siemu. Thank you. Chair, mine is just to thank the governor for Siaya for coming for this committee meeting and remind him that because he is looking for second term, that you don't want to be re-elected as governor. I meant yours. You don't want to discuss it here. Chairman was just to remind him that he continue to serve the people of Siaya because my second home is in Siaya. So please do the best for my people. Thank you.
Okay, any other closing remarks?
I don't have. I just wanted to tell the governor we'll be visiting you soon as energy committee to come and see where the nuclear plan will be put.
Oh, you're welcome. It's very near where the fish is.
Governor, your final comments?
I want to thank the committee. I want to emphasize that on my part, I really value this process, oversight on account of the Senate and accountability that we all require to abide with in terms of the Constitution. So however difficult the questions are, however complex the questions are, I think we are duty-bound to appear before this committee and other committees on the Senate. And when you sit on these functions, you sit under a delegated authority from the people of Kenya. So I want to thank you, and it's always a pleasure appearing before the committee.
Very well. Thank you, Governor, for honoring our invitation to come. I think we are very grateful. Having been a senator and a minority leader, we are very privileged to have you come back home and respond to the issues. I think we have seen from when we started, was 2022-2023 financial year. We started with water. There were a lot of issues in Sibbo, and then we now came to hospitals and also funds. But there has been a noticeable improvement in addressing the issues that the auditor has raised, and to us, that is the spirit that we need to have between us and the governors. So we are very grateful, and we look forward to maybe after April to visiting Siaya to visit some of these entities. So thank you very much. I think, honorable members, the meeting is adjourned until Monday.